How is cystic fibrosis diagnosed in newborns? Imagine a tiny baby just a few days old, and doctors are working to find out if they have cystic fibrosis. The main way they do this is through a newborn screening blood test. This test is usually done within the first few days after birth, often before the baby leaves the hospital. A small blood sample is taken from the baby's heel or sometimes a vein. This tiny sample is then tested for a protein called immunoreactive trypsinogen, or IRT. Babies with cystic fibrosis tend to have higher levels of IRT because their pancreas produces more of this protein. If the IRT level is elevated, the next step is usually a second test on the same blood sample. This test looks for mutations in the CFTR gene, which is responsible for cystic fibrosis. The CFTR gene controls how salt and water move in and out of cells. When there are mutations, this process is disrupted, leading to the symptoms of cystic fibrosis. If the baby has high IRT and at least one mutation in the CFTR gene, they are considered screen positive, meaning further testing is needed. The most definitive test to confirm cystic fibrosis is the sweat chloride test. This test measures how much salt is in the baby's sweat. Babies with cystic fibrosis have higher salt levels because the faulty CFTR protein prevents proper salt transport. During the test, a small amount of a safe, stimulating solution is applied to a small area of the baby's skin, usually on the arm or leg. Then, sweat is collected over about an hour and analyzed for chloride levels. If the chloride level is above a certain threshold, it confirms the diagnosis of cystic fibrosis. It's important to know that many babies who test positive on the initial blood screening do not actually have cystic fibrosis. Some are carriers, meaning they have one copy of the mutated gene but do not show symptoms. That's why the sweat chloride test is so important. It helps confirm whether the baby truly has the condition. Early diagnosis through newborn screening is vital because it allows doctors to start treatment early, even before symptoms appear. This can help improve nutrition, lung health, and overall growth. In many regions, newborn screening for cystic fibrosis is part of the routine tests done before a baby leaves the hospital, making early detection more accessible. To sum up, diagnosing cystic fibrosis in newborns involves a few key steps. First, a blood test measures IRT levels. If elevated, genetic testing looks for CFTR mutations. If those results are positive, a sweat chloride test confirms the diagnosis. If cystic fibrosis is confirmed, a team of specialists will guide ongoing care and treatment. Always remember, if you have concerns about your baby's health, talking to a healthcare professional is the best step to get personalized advice and support.